It's the first month of the year and we are sure that you are prioritizing your goals for the rest of the 365 days of the calendar. But ladies, have you prioritized your health? Let us remind you that January is Cervical Cancer Awareness Month, which happens to be the second leading cause of cancer deaths among women in India. We understand that you may not entirely know about this cancer and its symptoms, so allow us to explain it to you. Cancer starts when cells in the body begin to grow out of control. Talking of cervical cancer, it starts in the cells lining the cervix, the lower part of the uterus or womb. There are two main types of cancer of the cervix: squamous cell carcinomas and adenocarcinomas. It isn't clear what causes cervical cancer, but it's certain that HPV or human papillomavirus plays a role. Your environment and lifestyle choices can also be the risk factors for developing cervical cancer. Now let's talk about the symptoms of cervical cancer, which is something you should definitely know about.
Most common and most important sign is bleeding. So either the bleeding can be a heavy menstruation, or it can be bleeding in between the menstruation, or something typically called as the postcoital bleeding, which is bleeding immediately after intercourse. Secondly, if it is very advanced, then there can be a lower abdominal pain, a lower backache, and if there is a lot of blood loss, then the woman can have anemia, so the woman can feel very tired, and if it is excessive, then also many women are pale to present with. So how do we diagnose CA cervix? The most common method is a pap smear, which is a very simple test where we see the cells during a procedure, which is called as a pap test. And to confirm the diagnosis of CA cervix, a biopsy is mandatory. Other than this, just to see the disease extent and how far it has spread, CT scan or MRI scan of the pelvis is also needed in many of the situations.
It's important to see a doctor if you experience any of these symptoms without any delay. The treatment starts immediately after the diagnosis.
The first option obviously is surgery, but surgery is very limited to very early diseases. The moment it exceeds stage 1B up to stage 4, radiotherapy has excellent results in CA cervix. So it is called as a radical radiotherapy, along with many times chemotherapy, but the chemotherapy is a very minor chemotherapy, usually in the daycare. For the radiation, there are advanced techniques like volumetric arc radiotherapy and rapid arc radiotherapy techniques, wherein we can beautifully target the disease to the cervix and the high-risk areas, and at the same time spare all the normal organs in the pelvis like the urinary bladder and the rectum. So all this leads to better quality of life.
You can reduce the risk of developing cervical cancer by having screening tests and receiving a vaccine that protects against HPV infection. We hope we were able to give you some insight into cervical cancer, its causes and effects. We would urge you to take charge of your health this year along with your other goals. Do let us know in the comments if this helped, and do subscribe to SHOWSHA for more health related videos.